Okay, I am changing a dressings on wounds. I've identified myself, I introduced myself, identified the patient, and checked to make sure the medical order said to do this, and I've assessed that it needs to be done. I've explained to him the procedure, and I've already given pain medication. So I'm going to bring his bed up to a good working position for me. And I'm going to perform hand hygiene and open up. I've gathered all my supplies, so I'm going to open them up. And everything I checked to make sure that it was intact and dry and expiration date was good. Sorry.
Okay, I'm ready.
Whoa, either one of those made it. There we go. And I think I'll get one more. And I'm going to open up my wound measure just so I can make sure I can get this. And then find some gloves.
When I checked your order, and it looked like you maybe needed some suctioning and shaking today.
I'm going to uncover him and drape as well as possible. I'm going to take these off from the edges. If there's any kind of sticking happening with the tape, I'll use some adhesive remover. And I'm going to check out the dressing. It looks sanguous and rather moderate. I'm just going to close these up here. I'm going to do some hand hygiene. Put on some new gloves. I'm going to measure this wound. And it appears to be about 6 centimeters. And I'm going to measure that. This looks like it's the deepest here. And that's right at 1 centimeter. So I'm going to toss both of these. And I'm going to start cleaning the wound. I use a lot of Q-tips if it needs it. I'm going to start from the center, rolling out to get out, to get all the exited off. And then I keep wetting it, throwing it out, using it, throwing it out. Getting another one. I'm just So that's what I would do for that. And then I would clean it, I would dry it, the edge of the skin once, and then throw it out. And then I would get another one and throw it out. And then I would get another one to dry around there and then throw it out. So that's cleaning it. Now I'm going to put on some new dressing. So I'm going to do some more hand hygiene. Put on some new gloves. I'm going to fluff my gauze here. Make sure that some of the wicks can get up to the gauze I'm going to put on top. And I'm going to use this to help stick it in underneath. I have another one I'm going to put on. I'll put this, stick this underneath here. Make sure that none of the gauze is over on the good skin. Okay. And then I'm going to put one gauze on the wet wound and put another one on top. And then my AB, I'm going to tape that down, and then I'll initial, date, and time it. And then I'm going to throw all of my stuff away. Just making sure that the patient doesn't see any of the wound dressing. Cover him up. Make sure I do my hand hygiene here. And then get him comfortable. And I want to document that I did this, and also I'll make sure that it gets done every shift.